Great, thanks. I will end up going a couple minutes into lunch. This is typically a 45 to 60-minute presentation, and so I've had to cut it down. And Ella, if you don't mind to help me, once we get to about 5 to 12, you can just put your hand up and let me know, because I do want to pose a question to the group and get some feedback. So that'll just give us some time to make sure that we don't go 15 minutes into lunch or something like that. So thanks. I am in Saskatoon, so I'm going to give an acknowledgement to the land that I live on. Saskatoon is in Treaty 6 territory and homeland of the Métis. I personally pay my respects to the First Nations and Métis ancestors of this place and reaffirm my relationship with the peoples of this land. As a direct result of the conservation and care of Treaty 6 by First Nations and Métis people who have walked this land for centuries, I'm privileged to live, play, and personally grow on this territory. I fish and I hunt these lands to provide for myself, and I've been able to share what the land has given me with friends and family. While I recognize that as being a descendant of a European family on both sides, that is my privilege and not my right to be able to harvest from this land. So I have some pictures here. In the middle is Mr. Bear, who I met on my way up camping this summer. This is actually a screenshot from a video where my truck window goes up very fast as he took a hard right towards me, so I won't be stopping again. On the right-hand side is Wyakwin Lake, which was the destination for camping, where we get our fish for the year. And on the left-hand side is a picture from my hunting trip a few weeks ago, where it was just absolutely gorgeous morning with the hoarfrost. And I just want to personally express gratitude to my friend who's taught me how to hunt, but this year I wasn't able to fill my tag, and he gifted me the deer that he got on our trip, as he has rights to hunt whenever he wishes to provide for himself and his family. So I'm very grateful to Terrence for giving me some meat security for the next year. So overview of what I'm going to try and get through in the next half hour is the importance of consistent messaging around FASD and the use of language, appropriate language as we talk about it, and those who are affected and their circle. What's important too is I want to tell you about how the guide is developed each year, so you know where we're coming from, where this information is generated, from what sources, so you can hopefully have confidence in the messaging. I'll go through the relevant guide content and suggestions that we provide. And again, hopefully I have picked the right stuff to talk about. The good news is you have a link to the full messaging guide as part of the resource package. So that has everything I haven't covered in full detail, and also has the references to what we have cited. And as well, at the end, what I want to really save time for is I want feedback from this group as to what CanFASD can consider to augment or add in the next iteration of the guide, as you're on the ground and seeing this on a daily basis, of best ways to communicate and other things we need some more information on to guide people in at least what we believe right now to be the right direction. So the importance of consistent messaging and language. So why do we have this guide? And this is a complex question, but an important one that I just review briefly. So common messaging, as the name implies, is the consistent use of information between individuals, organizations, etc. And when crafted carefully, language and messaging can increase the uptake of information. So we try to make it meaningful and memorable, as well as improve awareness and understanding of an issue. So for us, it's what FASD is, the associated features of FASD, trying to reduce stigma, shame, and blame, and previously held negative expectations or assumptions of individuals with FASD or their families. Trust is integral to common messaging and language use. You have to have trust in the person delivering the message, trust in the message itself, and trust that there's evidence that backs the information that's being presented. So the function or purpose of the guide is to assist people in communicating about FASD, trying to increase consistency in language and messaging. When you're getting multiple messages, different language, it can be quite confusing and kind of easy to give up on the topic when you've got so much varying information, you just don't know what to trust. We also want the guide to help improve people's understanding of FASD, reduce the stigma, and also take a focus on strength-based language and also evidence-based messaging. So how do we actually develop this guide? So in January, what we do is we pull all the literature published on FASD PAE in the previous year. And from that list, we actually create a top articles list, but this is also an opportunity to be exposed to all the literature that could inform our guide and how we discuss FASD, and provide some additional support to what we have or some new knowledge into what we need to add. So we gather this evidence and we review it as a large group. So the staff at CanFASD, Family Advisory Committee, and research leads will review this information and the updates that we make. We also do a second reading, which is actually turning into a sixth reading of the document to see what we can update that was already there. Every time we read that thing, we say, we actually could improve this language a bit. So those edits happen. Again, once the revisions are made, it's reviewed by the RLs at CanFASD staff and the Family Advisory Committee before it's signed off and released to the public. So although we do this annually, and yet we call it a common messaging guide, the importance of this annual update is that FASD is still an evolving field. We're always getting new information about different topics, and therefore we always have updates and edits to add. So it is an important document to have a look at when we release it annually, especially so we can have consistency in language use. Okay, we'll get into content of the guide. So this is the numbers section. And just a general comment, some of this will be knowledge you already have. So it is repetitive. Repetition is okay. And it just also reinforces you're on the right track, at least with what CanFASD suggests for how to talk about FASD. So the prevalence of FASD, so we estimate that approximately 40% of Canadians are impacted by FASD. That is a number that has been concluded from looking at a large body of research, or I shouldn't say large, but the body of research that we have to date on prevalence of FASD. Sometimes people have said 1%, some people say 5%, but what this means is actually there is variation between populations about who you're talking about. So an example would be down in the States, they usually say 5%, but depending what area you're looking at and doing a prevalence study, could be 8%. So it really depends on population, whether that be geographical or characteristics of people where we see that prevalence of FASD reporting may differ. So for example, we say 4% for the general population, but it's about 11% in the child welfare system, 23% in the youth justice system, and about 18% in adults. So you can see when you narrow down who you're looking at, these numbers can change. How much alcohol is too much during pregnancy? So we know that people will consume alcohol for various reasons during pregnancy. And when it comes to providing recommendations, there is no safe amount of alcohol. Although the Canadian Diagnostic Guidelines do have a exposure threshold in order to make a diagnosis of FASD, we do have some preliminary research that perhaps even lower levels of exposure can have impacts on the developing fetus. So what we know right now isn't enough to be able to provide any recommendations or quantities. So we always say, and the experts agree, that there's no safe level of drinking during pregnancy, and it's safest not to drink during pregnancy. So getting into some of the terminology and language that will hopefully be consistent with a term that's still used to some degree is secondary disabilities. Secondary disabilities insinuates that these difficulties are not central, prominent, or be as important as perhaps the brain domain impairment or physical problems associated with FASD. So what we recommend is you replace secondary disabilities with adverse outcomes, difficulties in daily living, impacts or risks. And adverse outcomes should also be considered alongside success and the possibilities, not to bias or limit expectations around life trajectories. So what we have to do is acknowledge, and I might end up repeating this a few times, we do have to acknowledge some of the difficulties that people will have, with FASD will have, but we can't define them by their difficulties, and we need to balance the messaging about FASD and individuals. I was able to attend about a year or so ago training for new FASD clinics on how to conduct assessments and write reports. And Dr. Rajani states that on clinic day, when you're providing a diagnosis, the first thing you should do is actually discuss the strengths of the individual that were identified to lead with that, and also to remember those strengths throughout working with the person. FASD has also been called an invisible disability, but the word invisible can invalidate and stigmatize individuals and their family. That FASD isn't recognizable physically, so perhaps it's not as important. And also too, this is an interesting term, which we're suggesting that we replace with hidden disability, particularly because 10% or less of people with FASD actually have the facial features. And even then, people who don't have training in measuring the facial features shouldn't be walking around and making conclusions themselves. So we prefer or are recommending the term hidden as opposed to invisible for these few reasons. Disease and syndrome is something, two terms that have often come along with FASD. Syndrome, obviously, they use in the States still, but using it FASD, one aligns with fetal alcohol spectrum disorder, but disorder also aligns with the language that's used in the 2015 diagnostic guidelines. Using disorder or disability better reflects the spectrum of FASD and ensures consistent language and understanding. Other terms that we sometimes hear is that it's a disease, and this may indicate that the disorder is transmissible or even infectious, which is not accurate. And also coming back to syndrome, it also indicates that there's a set of signs and symptoms that often occur. However, with spectrum disorders, which FASD is, and also considering autism as well, there's such great variability between individuals that at least the medical term syndrome actually isn't reflective of the disorder or whatever. It isn't reflective of the disorder whatsoever. And therefore, we should just avoid that language. Speaking respectfully about Indigenous populations, so FASD is not an Indigenous issue. If you were to break down the equation for a PAE pregnancy, all you need is someone who can become pregnant, who is sexually active and not using protection, and then consuming alcohol within any point in the pregnancy, including whether they know of the pregnancy or not. At no point is race or ethnicity involved in that equation. And we also have to remember too that there are some cultures that traditionally do not consume alcohol, but that doesn't mean that they all do not consume alcohol. So we can't make any conclusions that a PAE wouldn't occur within certain groups, as there is certainly variability within each group. But coming back to the Indigenous population, one, recognizing that it's not an Indigenous issue, and replace outdated terminology with the term Indigenous, which captures First Nation, Métis, and Inuit. Strengths-based language and healthy outcomes. So as I mentioned, we do have to recognize the challenges that people with FASD have. I mean, otherwise, they wouldn't be able to get in touch with the supports that they need. And it is a reality at times day to day. But people with FASD also possess diverse strengths, abilities, and resilience. And I know with the sessions I've attended, today I was in the breakout room with the RAP people. We certainly understand the strengths of people with FASD, and more importantly, people with FASD know their strengths. So leverage that knowledge and insight when trying to identify all the strengths of an individual that can be fostered and help them succeed. We also refer to people with FASD in first person. So it's an individual with FASD, a person with FASD. Autism was in that realm, a person first language for a while, but they have the one word that they use frequently is reclaiming the diagnosis. So now the suggestion is that they are referred to as autistic people. We have not heard that from the FASD community. They are preferring that FASD does not define who they are. It's just something that they have. So we go with the first person. Oh, let's try that again. First person language. So I just have a picture of the top of an article that Katie Flanagan spearheaded on a review of strengths of people with FASD. Wonderful paper. I'm biased, but this has actually spurred additional studies. So we're actually recruiting people with FASD right now into a strengths-based study. So check out, here's a shameless plug. Check out the CanFASD Twitter or website. We have links to a study for adults with FASD to participate in, to communicate their strengths so that we can, again, foster positive language and just looking accurate picture, challenges, but also strengths. Suspected FASD. So this was actually brought up by family members. Using the term suspected may add the misperception that FASD is linked to criminal offending and may further stigmatize individuals with FASD. So just referring to someone as a suspect or suspected of committing a crime. And part of this will be that, a lot of people with FASD do have involvement with the justice system, but not using suspected in this realm is just not communicating what is intended to communicate. So we recommend that you replace suspected with possible. Referring to challenges. So individuals with FASD are, I actually edited this slide this morning because it said individuals with FASD used to be referred to, but it has been clear even from some large conferences recently that individuals with FASD are still referred to as having brain damage and brain injury. But what we recommend to use is actually brain-based differences, challenges, concerns, or difficulties. Certainly there's an influence of alcohol on the developing brain, but communicating with the terms brain damage or brain injury may also lead to people not understanding the disorder and equating it with perhaps a traumatic brain injury, when this is not the case. Won't versus can't, and moving into how. Thank you, Ella. I don't know how many slides I got left, but I'll make it through. We want to shift in perspective. There has been a shift in perspective from seeing the won't behaviors as willful behaviors to understanding difficulties as resulting from these brain-based impairments that they can't. However, can't promote stereotypes and propagates negative expectations of people with FASD. So as people who support individuals with FASD, we have to change the mindset to how can I support success for individuals with FASD? So they can't do it now, but what can we do so that they can do it? So what has to happen to put that how into action? This also facilitates growth mindset and an increased positive well-being and sense of self for people with FASD. This too came up in a conference recently. Stigmatizing language is absolutely still used to refer to biological parents. So we just recommend that instead of labeling a mom or a birth parent, that person who uses or used alcohol and substances during pregnancy is acknowledging a fact, but not being stigmatizing. A big update this year for the guide was actually using the use of gender inclusive language. So we thank Lindsay and Nancy Poole for assisting with this section. Not all individuals who give birth to a child with FASD will identify as female. So we're moving towards gender inclusive language to acknowledge and be respectful in the way we refer to those who do not conform to gender normative identities or binary. So we want to adopt in gender inclusive terms such as parent or the birthing parent, or pregnant women and people for individuals who have a child with FASD. Although best practice would be, of course, if you're working one-on-one with someone, is to use the language that they prefer. I think I have two other issues. One just came up in the WRAP program. So, and actually I might steal the graphic that you have, Patricia, if she's still here. People with FASD often function at a level younger than their chronological age. And again, this is a difficulty we have, and we don't want to live in the world of difficulties. But it's important to communicate what struggles an individual is having at the time, so that whoever you're working with is, if it's a teacher or another community support, they understand the reality, but that's also followed up with information on, yes, this is a concern, but here's what we're doing, or here's how we adapt to this situation. And again, reiterating what some of the strengths are for the individual with FASD. Another thing too is peer pressure. And again, not just in school, but afterwards. Some individuals with FASD may have difficulty with social functioning, which can be social skills, or getting along with peers or being accepted by peers, but also psychosocial vulnerabilities. In one project I worked on with actually Mansfield Mella, was offenders with mental disorders, and a segment of that population had FASD. This individual was just asked by friends to take this gun and rob a convenience store, and wanting to please these individuals, they did so, and now they have a criminal record, and was an out of character behavior had this not been suggested, and had they not been taken advantage of. So people with FASD may have characteristics and experiences that increase their vulnerability to environmental influences or external pressures, but this may be limited to certain circumstances, and of course isn't across the board. So I understand not a huge amount of information in a short amount of time, but if you go to the Common Messages Guide, you can see what other topics we touch on. And based on that, if anyone has some, I'm going to stop sharing my screen so I can see if there's anything in the chat. Any suggestions on what we might consider adding language-wise? I'll be able to tell you if it's already in the Common Messages Guide or if that's something we should consider, which it's timely since it's December, as we'll start to work on the guide in February, March. The term pregnant people includes pregnant women. Use the phrase pregnant women and people can be seen as othering. Thank you. I'm gonna write that down. Actually, we're saving the chat. So good point. Again, as I said, every time we read through this thing, we find something else. So I will bring that to the team. And yes, the link to the Common Messages Guide is in the conference resource package. So raise your hand or start talking if you have any ideas of what comes up frequently with you that you have to address in language or messaging. Tiara, sorry.
It's okay, it is Tiara. So just something along the lines of the messaging that I wrote it down and now I've lost it. I apologize. Okay. So the graphic that you showed from CanFASD about, no amount is safest, and that's certainly like one angle. But has there been any conversations about kind of increasing the public messaging, knowing that the majority of pregnancies are unplanned? So altering the messaging to include some messaging around, if you're choosing to drink, are you on reliable birth control? Those kinds of things, because we know that angle of if you're pregnant or trying to conceive only gets at kind of that small percentage of alcohol-exposed pregnancies.
Yeah, that's right. I'll try to remember as many points as you made as possible. Just remind me if I forget something. Yeah, typically in the full presentation, there's a section that I have on when people, they're drinking, that maybe perhaps not trying to get pregnant, but end up becoming pregnant, that it's best to reduce or stop alcohol as soon as you know. When it comes to the prevention of how to plan for pregnancy and reducing that alcohol, I have heard the suggestion that people stop using alcohol or begin reducing using alcohol 3 months before they actually start to try getting pregnant. When it comes to the messaging around that, I know we have done some stuff with some campaigns within CanFASD. I don't know the level of focus currently. Perhaps that might be like a Lindsay and Nancy Poole, or actually, well, Ella's here too from the center, so she may have some thoughts on that. Can you remind me if there's anything else in your comment that I missed?
I think it was more of the conversation, like, are we, trying to also include messages around if you're using alcohol and you're a child, kind of bearing age, what steps are you taking any precautions, knowing that the majority of pregnancies are unplanned and also the
Right.
majority of people of childbearing age do use alcohol.
Right. This might be something that is a message that we do need to incorporate and perhaps focus on more. You're right. It was something, the numbers have changed a bit, but 50 to 60% of
Yeah,
pregnancies are unplanned. And this is actually especially high in youth who are,
exactly.
consuming alcohol as you get into
Mhm.
high school and university, and just learning about yourself sexually and becoming sexually active as well. So there's certainly a space for this messaging. We'll have to work with the center and within our own group to consider messaging and perhaps what CanFASD can do to improve our messages around that.
Yeah, just to jump in on that, thanks for bringing that up. And that's definitely something that the kind of prevention team led by Nancy Poole and Lindsay Wolfson and I are involved in as well, and many people in this group as well. We talk a lot about what the preconception period really is and how there are so many different audiences to reach within that, including unplanned pregnancies and girls who may be or women or anyone who may be drinking and not using contraception, and sort of how to reach that audience and get this message out. And so it's something we're constantly thinking about, and how to maybe work with sexual health groups. And but yeah, it's something that's kind of, we're starting to think about. It's an emerging topic in our conversations. So yeah, thanks for bringing it up. And Andrew, yeah, I see there's one more question from Chris here.
Yeah, let's take that.
Hi, I was just going to actually speak to that, because in when I'm doing my presentations, or those statistics were in our last, or that talking point was in our last training, talking about the fact that 61% of pregnancies were unplanned. But I always mention it's not necessarily a negative thing. Like, we're not talking about poor teenage moms that were, unfortunately got pregnant. That's not how I approach it. Basically, it's having the conversation that if you're having unprotected sex, you're planning a pregnancy, and therefore no alcohol is best. That's sort of how we've had that conversation on how to approach that before. And then it's also doesn't, again, put the stigma on the pregnant person. It is that on everyone. We all have a role to play in supporting alcohol-free pregnancy. And so again, if you're having that unprotected sex, then you're possibly planning a pregnancy. And so I find that a lot of people relate to that during my presentations. And then I also saw someone putting something about promiscuity and so I just wanted to speak to that, because when we talk in the presentations, or when I talk about behaviors and looking behind the what's going on behind that behavior. So when I do talk about promiscuity, sometimes it has nothing to do with sex, right? It can be seeking economy or shelter, or might be lots of reasons behind it, or learned behavior. But I just wanted to speak to that. Thank you.
Thank you for that, Chris, for sure, because I was racking my brain on that question. I'm sure there's a few terms that are used within the work I've done previously. People with mental health, especially youth, people have called it high risk sexual behavior. That's doesn't really tell you exactly what's going on. It could be multiple partners. It could just be unprotected sex with one partner, or what it is. But at least it takes that label off of promiscuity, which is a loaded word. But if anyone else has any suggestions or of the language that they use, or where else they've heard recommendations for how to address this topic, that'll probably be the last thing we get to do before we take a break for lunch.
No, I'm Leanne, and I'm the one that stated it. I'm from Grand Prairie. And how that has come about is I've done caregiver support group, and a lot of times the birth moms or daughters are referred as, they're so they use that term, and I'm trying to turn it around where it is not have such a negative connotation. So I was thinking of if there were any wording that could be discussed and not so negative for the person they're talking about.
Yeah, hopefully Chris's answer was helpful with that, and perhaps high risk is a good behavior, a good change. The one thing I actually want to mention too, I'll be super quick here, is when people are using the language and messages that aren't accurate or stigmatizing, is not calling out, but calling in, to use it as an opportunity for education and not a finger wag. I'm a finger wagger by nature, and thankfully Jackie Pie and who else calms me down? Someone else brings me back down to earth, and put me into the mindset of calling in as well. And also something too, and I actually could do this with children when they don't pronounce words right, is instead of repeating what they say back, is insert your own term. And so perhaps you can onboard people in more of a passive way when discussing about a topic as well. So that's more of a calling in than a calling out